party mad. Girl, them a say Gaza party bad. Girl, that shit like a butter bag. Zamunda gone with 40, girl. I grade. I go short in her hand. Me no want see no man a par with 40 man. Girl inna the club with them a party pan. Them say the world party man, the party done. Girl, them love how my pants them straight up. Them love how my clocks them lace up. And at girl not take bait up. Hey boy, me a tell her this straight up. Say, we no beg people in a raving. If I even if spend half a saving, we no know when me a go in a the graving. So right now me raving and everybody jump is a plaything. Happy like picnic for weekend. We no know when me a go in a the graving. So right now me raving. So
WEFM 99.9.
Activated Mornings on WeFM 99.9 is on now.
Did you want us to move on?
All right, so we are back with you for another segment of our commentary session on today's Activated Mornings. It's Friday.
That not sound like a Friday, no.
It's Friday. Listen,
Good morning.
I brought the energy earlier. Hold on.
You see
Right?
the stamina thing? You cannot run an 800 meter on a Roleza. Clearly, we could see that. The stamina thing, you gotta.
Yeah, I can't run, period. If you see me running, something is wrong. Something is wrong. All right, I'm just letting you know. All right. So yes, it's Friday. We are here with you for another commentary segment for today. In studio, we have Dianna, Christal, and myself, Roleza, and y'all.
No, okay. Ask who's y'all.
Y'all.
No. It's
You know,
Gaza, Missy.
I was about to say,
No, Beanie Man. No.
Who the girl, the what? That's what.
Y'all.
No. We're
Beanie
about.
Man will forever be the king of dancehall. I don't care what nobody say. And clearly, it gives an idea of my age, but Beanie Man will always be the king of dancehall.
Listen, I love Beanie Man. I mean, his lyrical content for some of his songs are a little questionable.
Yeah, all of them
But
is
I
dancehall.
love-
All of them is dancehall.
Oh, not all dancehall songs are,
I read
big man no deal with back pan back under.
Yeah, but we know that we know that some of them they try to do a balance where they will talk about serious things, so like Spice with the black hypocrisy, etc. So she
That's
brings
probably
serious
Spice's only conscious song.
Well, at least she brought
I'm not a
something,
Spice fan.
But some of them, like back in the day, Lady Saw, like Lady Saw has this really good song that I don't hear a lot, being played a lot. You don't have to be, something to the effect you don't have to be a mother to be a woman. It's a really nice song, really nice song.
No
so
bells.
so as it's listen, y'all too young for me.
I never.
This is me.
Whatever.
Y'all too young for me.
Whatever. But still, you don't want nobody to say tanty.
No, you can't call me tanty because I don't look like a tanty. That's the whole point. If I didn't
But
look
she
like a
in
tanty.
here bragging on her age. Y'all too young for me, but no, we can't call you tanty.
It's the fact that Christal is always remembering this for me, eh?
Yeah.
No, because she knows me.
WhatsApp number to reach out to
the
us.
song is called No Less Than a Woman.
No Less Than a Woman. I've never heard that title.
No Less Than a Woman. It's a really, really good song. So as much as Lady Saw sang as Sata Slackness, which I happen to grow up listening to and I have no problems with. I have zero problems with. She also did sing something, at least one really and truly positive song.
I think there's another one for her that's kind of positive too.
The country song?
No, I don't remember it. But there's another song that I'm thinking, These Streets Don't Love You Like I Do.
That's Tanya Stevens.
Well, why are you saying that song the same?
No, they don't.
Boy, if shame could have killed her on them.
Friday's your day of shame or what? I don't understand.
Yeah, boy. All the shame. But boss man outside like COVID.
Outside like COVID.
Outside like COVID.
So since Christal has introduced the topic, let's jump right into it. Right, there is a story here on Am I doing the wrong thing? No, I'm not. All right. So there's a story here on Asbert's News Network, and the question is COVID-19 on the rise? Nurses alarm concern. Oh, nurses alarming concern at MCMH. All right. So the story reads, not reading the whole thing because you can read it yourself. In the heart of MCMH, whispers of a potential outbreak of COVID-19 are growing louder, and the fear is spreading faster than the virus itself. A concerned nurse has raised the alarm over what she perceives as a deliberate attempt by hospital administration to downplay the situation, putting staff and patients at risk. It's been weeks since we first noticed something was wrong. Several nurses confide. A man with flu-like symptoms came in, and within a week, 2 patients had died. Now, we've got more cases, and there's proof that something is up, all right? The article continues, despite several warnings, the nurses feel their concerns are falling on deaf ears. No one saying anything official. They complained, frustration etched on their faces. Even in the hospital, everyone's wearing a mask, which is unusual unless there's a serious threat. Why are they not telling us what's going on? All right. So, as usual, for balance reporting, Asbert News Network, ANN, contacted the Minister of Health, who was at home also sick with flu-like symptoms. Quoting the minister, said, I'm not aware of any COVID-19 outbreak at the hospital, he stated, but I can confirm that 1 person died from COVID-19 about 3 weeks ago. The minister also added, COVID-19 is still around, and if you are not vaccinated, you are at a higher risk of catching the virus. Nurses are wearing masks to protect themselves from Saharan dust and other environmental factors. All right, so is there or is there not an increase in COVID-19 cases?
Is there or is there not?
I find it hard to believe that there is some sort of cover up. I find it hard to believe at this stage that we've gone through 2020, 2021, and there's like this cover up. It doesn't make any sense to me, right? As the person on the outside, acting as a person on the outside. But they always told us that COVID will always be around.
Yeah.
Just like cold is always around, flu is always around, different strains and so on. There are measures that you should take to protect yourself during the cold and flu seasons, especially when we have a big influx of tourists. I don't know if you guys noticed.
After Carnival and after Christmas.
Yeah, bam, bam, bam. Some illnesses going around. I have noticed that, like, I've known a couple people who have gotten seriously ill from flu-like symptoms. I'm like, this is unusual. I've also heard of a number of people contracting dengue too. But the nurses are the ones who are in the situation. They're in the kitchen. So they would get to see and know certain things. Question is, if it is that you've had that 1 person dying of COVID, what is the record for months prior? Is this a norm for, like, okay, let's say once a month we have somebody dying from COVID or, like flu, because some people die from flu. Like, what is the record? And is this something that is alarming? If it is alarming, then should we sound the alarm? Sometimes, as the article in the beginning says, you become more fearful than needs be, if that makes any sense. So those are my concerns at this time. Or thoughts.
Okay. I have to honestly say that when I read this article, when I heard of this, I didn't really look into it that much. I didn't take it that deep because of what we went through in the past with COVID. Basically, we had this COVID outbreak. We had the whole vaccination campaign and everything that surrounds that. So for me now, hearing of COVID, I'm just like, oh, okay. Honestly, maybe that's not a good approach to have, but that's what it is for me. Oh, okay. Oh, okay.
But is it your okay because you're just accepting that COVID is going to be with us, just like how the flu is with us?
Part of the reason, yeah, because when it initially came in and we were told that, Christal just mentioned that it's gonna be here with us, it's gonna be here to stay, and we have to get accustomed to that to some extent. I don't know, I guess that's part of it. Oh, okay. All right.
All right.
Unless we're gonna unless there isn't any official thing to say. Yes, we have this issue with COVID going on, but unless there is something else that comes out now and says, well, we do have COVID going on, and we probably need to bring in another vaccine or something else like that,
Ooh,
then I
Lord.
might look up. But for now,
Nonsense.
I'm just like, oh, okay.
All right.
Yeah.
So I guess it's a quiet acceptance for you that of this particular virus.
Yeah.
I think for me is that, as Christal said and Dianna is also echoing, is that COVID is going to be here with us, right? And we will see that within different periods of history, there are going to be outbreaks of whatever, right?
Yeah.
Different outbreaks of whatever, illnesses, diseases, etc. The thing of it is that persons to themselves would know or should know how to protect themselves.
Yeah. At least
So I think
know.
the onus would really be on persons to do what it is that they think that they need to do. Yes, if there is an increase, I would like to hear something being said from the ministry, right? Because at least it would put you on alert.
Yeah.
We do have now that there's a confirmation of that of increase in dengue cases, and we would get to that story very shortly. But the thing of it is that maybe just saying it, letting us know that there is an increase would put more persons on the guard, especially those who are particularly vulnerable.
Yeah.
There is no stigma attached to wearing a mask. If you think that you need to wear your mask. And interestingly, when I looked at that NEMO, that consultation the PM had with persons from the Southern Grenadines, I think may have just been Union. And when I looked at some persons in the room where it was being held, persons were wearing masks.
I noticed that.
Certain officials were wearing their masks. And I when I saw it, I was like, it's something up. But then I thought as well that this must just be their way of what's the word I'm looking for? This might just be of their preventing themselves from possible exposure. So really and truly the onus has to be on us. For those persons, as I said, who are more vulnerable or most vulnerable, wear your mask if you just don't feel safe being in crowded places and around persons.
Yeah.
So.
You know what? When you see people wearing masks, it doesn't necessarily have to be because of COVID. It could be flu is going around. I don't want to catch any flu. Let me put on a mask.
Or I don't even want to infect others, so I'm
That
keeping it
too,
covered.
I have a little cough. Let me put on something, right? It could also be that person's immune system might be impacted at the time, so they're putting on a mask just to prevent, because their immunity is so low or lower than normal. It's easy for them to show symptoms and contract diseases and what's not. So it could be like that person, for you to not overthink it. Normally, SVJ Health's Facebook page would share stuff. So
let's wait.
the other side of it is, like I said before, if it is now the norm for at least one person to pass away within a specific period, and that one person dying 3 weeks ago was not outside of the norm, are they obligated to share that information with the public? Would that information be taken the way it's supposed to? Would it cause unnecessary alarm? I don't know.
Yeah.
But mask up, people. Do what you got to do personally. Don't sit down and wait on the Ministry of Health to protect yourself. What's wrong with you?
Yeah, and also in the article, the minister did say that there are some persons who are wearing masks because of the Saharan dust, and we realize that it's heavy, and those persons who have allergies or asthma, etc. Presence of Saharan dust is a terrible time for them. So do what you had to do. That's how I see it. Just do what you have to do to protect yourself. All right.
Yep.
So
Better had not been any hush thing. Nah, they would never do that to us.
all right. And the Ministry of Health confirms dengue outbreak in SVG. All right. So the Ministry of Health, Wellness and Environment has confirmed a dengue fever outbreak in SVG 3 years after the last outbreak claimed at least 7 lives, most of them being children. The Ministry of Health on Friday, hold on. The ministry said on Friday that its epidemiology unit has recorded 119 dengue fever cases so far in 2024. Of those cases, 23 were in June and 82 in July. Based on the epidemiological data, said that in one breath, very good.
Congrats.
The number of lab confirmed cases of dengue fever has exceeded the threshold of the number expected, indicating that there is a dengue fever outbreak in St. Vincent and the Grenadines. The ministry is urging the public to adhere to all basic precautionary measures to prevent the spread of the vector-borne disease during the summer vacation. All right. So, I'm reading this article from Eyewitness News, by the way. All right. So, apart from what measures the government is doing, right, they also advising persons here in the article. However, we are calling on all home owners, community groups to search and destroy mosquito breeding sites or those with the potential to become breeding sites in and around your settings. People at risk of experiencing severe symptoms of dengue fever are children, pregnant women, and the elderly, especially those with limited mobility, are being advised to take extra precautionary measures as the virus can be deadly. The ministry will continue to monitor the situation closely, locally, regionally, and internationally, and will provide updates to the public accordingly. All right. And if you need more information, you can contact the Environmental Department or Health Department at 457-1729 for guidance and more information regarding source reduction tips. All right. The press statement said.
Which reminds me, gotta Google something, yes. But the numbers are higher. There are people who are getting sick with dengue. They don't know it's dengue, but the symptoms are like, you have dengue.
And I think that is a thing. Like when persons come down with, because there could be persons around us who do have COVID, and we will know because they're thinking that they just have a regular flu. They could actually be suffering from dengue or just a regular cold, you know? So, yeah.
Yeah, I mean, when you start feeling ill, and for the sake of, and this is the same problem we had during COVID, I think for the sake of the Ministry of Health and the nation getting a good idea of where we're at and what measures we need to put in place to be able to combat these. Did I say combat?
Well, I don't know what you're going to say after. So, combat.
Combat.
Oh,
man. These illnesses and diseases from a national level, they need to have proper records. So, go to the clinic. These are my symptoms. Let them get it on record. Let them do what they have to do.
But would you actually go to Christal, or would
Me?
you just stay home and fight it out?
I would have to go. I don't have a choice
Why you don't have a choice?
because it's not me alone live.
No, so you would go to be able to confirm whatever it is that you have, whether it's dengue, whether
It's better to confirm so that you can better treat. Most times when I'm ill, I know the difference between this is X and this is Y.
You would know the difference if you catch COVID and if you have dengue or if you have a regular flu.
There's a difference between COVID and dengue.
You could tell the difference?
Yeah, man. And then I could tell the difference between, okay, my body is overworked and this is something else.
You know, when COVID broke out, I honestly think that if the statistics were higher, right? Because I can legit see some persons just not going. They stay home and they battle it out without going to get that documentation to say that I came down with COVID.
And there were some people who did home tests
Yeah.
too. And they just sat there. And there's some people that died and stayed home and they didn't do what they had needed to do. And what's not.
Yeah.
Get them figures in. It's higher. No?
Yes, from a national standpoint, what Christal is advocating is
because
the right
the
thing
story
to do.
says, right?
But I am saying from an individual standpoint, I ain't going to the doctor to see if I get a flu. I going to stay home and try. If I'm close to dying, I might probably reach for a doctor.
Oh my goodness. So then how do we mitigate that, right? How do we find a balance between, and yes, they tell you isolate and How do we find a balance between confirming what I have, getting the figures into that they could know what to do and what to implement and what's not, and what alarm? Because perhaps could it have been a case where we were earlier, but because people didn't go and say, I feel real bad, and they got over because their immune system, the alarm came later on, which meant that more people would get infected because everybody just walking around, mosquito biting everybody, mosquito about knocking people ain't doing what they're supposed to be doing at the homes, which means that the ministry would not have had the additional drive to say, empty out this, walk around to do that, fog here, fog there. They changed the fogging thing the other day, right? Because there was a complaint about the bees for honey.
Oh, you mean what they use?
What
for
they were
fogging?
using. They
Oh,
changed that the other day.
I don't know.
Okay,
I don't
well,
know.
because some people don't really like the fogging. I didn't fog out my house every day.
You use bacon?
You're drowning in bop.
No, I don't.
You said Bob. I was Indian say bacon for everything. Yeah, it's interesting that you said Bob.
Gate and what's that? Is it horrible? No. I actually bought one this week. What is it? Friday?
You bought a bacon?
It's bacon.
Insecticide? Let me use the proper
Everything
word.
is bacon.
Let me use the proper word.
Everything is bacon. I like the citronella one. It's not so hard on my nostrils. I don't like to use them often, no,
I don't like to use any
because
of
they
them,
kill
but-
everything, including me.
And that's it. And when I see something and I'm spraying, I don't spray in moderation, and that's not good. So yeah,
You
that's
only need a
true.
little thing, and it's gone.
I just
My
it depends.
favorite
It
needs to
depends on the
die.
creature.
It
I
needs
need
to die.
Yeah, exactly.
Oh,
I need to make
sound
sure
like a spider.
you're gone.
John Tucker must die. Let's go ahead. Yeah, don't pay attention to me.
My fear with using those things, when I spray one thing, it'll just see something run out from somewhere.
Oh. Oh boy.
You spray a cockroach and a spider.
Well, you spray the spider too.
No, I don't want to see
I
the
don't know what
spider.
these images
Oh.
in my head.
Yeah.
But I
At
mean,
all.
there are certain things that we could do outside of waiting on the ministry to tell us to do them. Water catchments around the house, make sure you don't have, or if you do have, because some people would have,
Tires,
right?
flower pots with just that don't have soil, just water.
Empty
Yeah.
coconut shells, empty containers. But this is information that we're always getting. I can truly say that this information is always being broadcasted. Keep your surroundings clean, empty out water containers. I know for a fact Red Cross is always going around and giving out this information. I think the average man, we can do a lot more and we can have a lot less. I mean, there are a lot of things to be taken into consideration, but we can have less of these if we just follow the things that the people tell us to follow. But the average man just doesn't care. I just be walking around and seeing things in people's yard and want to go into the yard to turn over the containers.
You
with water,
should.
Don't
you
turn it
know.
over. Once say Hannah, come and turn it over.
You should
Yeah.
Turn it
just
over.
say, "Hey,
You're breathing mosquito.
look at you."
But I saw an article, I think it was from Jamaica. They said that they noticed an increase in, I think it might have been dengue, or at least something related to mosquitoes, after the passage of Hurricane
Yeah.
Beryl.
Yeah, you will, because there's
Yeah.
water everywhere.
Mhm.
A lot of things that you need to be conscious of. But a lot of this is mindsets and habits,
Mm-hmm.
especially if you live next to a river too.
Hmm.
Oh Lord! And some people,
Rivers, gullies. People have like some streams that run through their property, behind their property. So anywhere that
Yeah.
you see water settling. And I suppose what it is that you need to, because there would be, I think that's something that you can throw in water to kill mosquitoes, to stop them from
Just little-
breeding. So
Yeah.
persons can find out what happened.
Ministry of Health workers would pass around
Mhm.
and they do their
Right.
inspections. Let me leave it at that.
But I've seen them. They would come and they would
They would have-
yeah.
Yeah, but I don't think they're supposed to be like, okay, let me give you something. But there are things that
Right.
can be used, like you put it in water
Yeah.
and the
Oh no,
mosquitoes will never.
I didn't mean for ministry to give us,
No, but when you said that, I'm just
Uh-huh.
remembering.
that person's maybe wanting
Yeah,
ministry
like-
to give them.
Yeah,
No,
yeah,
I would encourage a Christal.
yeah. Pellets for
Right?
you, you get pellets. It's empty a drum.
Oh Lord. All right. So we're going to wrap up this segment and be back shortly with another commentary session on our Activated Mornings program. All right. Stay tuned for more.
Thinking of winning the lotto jackpot? Well, there is an easy way. Combo Play. Choose 4 numbers from 1 to 36. That's a